Welcome to Dacey's Divas. Hi, I'm your host, Dacey. Today we are live here at Saints Women's Center for Health and Wellness in North Andover, a brand new, beautiful facility just recently built in March. And we are going to take you through to take a look at the fantastic equipment, this wonderful staff, the awesome Dr. Divas, and also we are going to have a special treat. They have a live mammogram that they are going to show us today. So please come through and enjoy this beautiful facility and what Saints Women's Center for Health and Wellness has to offer. Don't forget, it's Breast Cancer Awareness Month. The best gift a woman can give to herself is a mammogram. Here we are with the superstar, Dr. Diva, Dr. Elizabeth Rafferty. She is here today to discuss about the importance of women's health, breast exams, and we are at the beautiful Women's Health Center here in North Andover for Saints. She is the director of Mass General Hospital Breast Imaging Center. How are you?
I'm well, Dacey. How are you?
Good, and you've been very, very busy.
Absolutely.
We're going to talk a little bit about your role here. You just opened up this beautiful brand new facility, March 1st?
Yes, I think that's about right.
And you've been very busy. You're with Mass General Hospital. Let's talk a little bit about yourself, Betty, and then we can talk about what your role is here.
Great. Well, at Mass General, I'm the Director of Breast Imaging, as you said, and we are a group of 12 breast imaging specialists at the hospital, so we do nothing but read breast studies and look for early cancer in women. And so we've partnered with Saints Memorial Hospital to work both at their Lowell facility and here in Andover to read all of the women's studies and bring them the same specialized care that we give in Boston.
Which is fantastic. And you've been here affiliated with Saints for how many years? A few years now?
2 years now. Mm-hmm.
And what is your role here, Dr. Rafferty?
So I'm also Director of Breast Imaging here. So basically I oversee the entire program, look at the equipment, look at the quality of interpretation, and coordinate with the other specialists in breast health.
Right. And we know that October is Breast Cancer Awareness Month. How important is it to have a mammogram?
I can't overemphasize how important it is, Dacey. Women, right now, it would be wonderful if we could prevent breast cancer, but we're not there yet. So the best thing a woman can do is have her breast cancer detected early, and the best tool for that is a mammogram, absolutely. With mammography, we found we're able to save between 30 and 50% more women from dying from breast cancer. It's absolutely spectacular. So while a mammogram doesn't find every cancer, it finds most of them. And so women need to come in every year to have their mammogram after the age of 40.
Okay. And self-exam also is important?
Self-exam is important. They all go together. Having a self-exam, having an exam by your doctor, and having your mammogram is sort of what I call the triumvirate of early detection.
Okay, that's excellent. Now tell us, you have a little good news to share with us.
Yes, I'm really excited because at Mass General we've been working on a three-dimensional mammography system for about 7 years now. And a week ago Friday, the FDA approved that system for use. And so we're going to have that commercially available right after the beginning of the year. And this is going to help us do an even better job in finding cancers.
In what way?
Well, the way it works is it helps remove the impact of overlapping tissue in your breast. Many women have had the experience of being called back from their mammogram only to be told everything's fine after we take more pictures. This technology will eliminate that step.
So
it will
step deeper.
Absolutely allows us to kind of look like pages of a book and see individual parts of your breast rather than the whole overall picture at once. And once we do that, we'll find more cancers and call fewer women back.
Now I'm with the top diva of operations manager, Jennifer Fagione. She runs this place like a glove, right? How are you?
I'm very well. How are you?
Good. Let's talk a little bit about what your role here is at this beautiful facility at Saints.
Basically, I'm the senior operations manager. I make sure that the day-to-day operations are running smoothly. I make sure all of the staff are doing what they need to do to make sure that women have the experience that we are striving for in this facility. Our main goal is to really give women who are generally the caregiver of the family a chance to really pamper themselves to get the medical care rather than going to the hospital setting.
Right.
So we strive to make sure every day we give that opportunity and that experience to women.
I know, I'm so excited. We're going to take the viewers through this beautiful facility, and I feel like I am at a spa.
Yes, it's a wonderful, soothing environment. We have nice, soft music playing in the background. We have wonderful physicians that are really give you the Boston quality care in the Merrimack Valley area. Very convenient location, free parking, beautiful lobby and space, and a smile every time you turn around a corner.
That's right. Now, what does your day consist of, Jennifer? I see you right now running around the office. You're very busy.
Yes, typically I'm on my cell phone constantly, redirecting, putting fires out, all behind the scenes, making sure that, nothing is happening on the front line, that everything is in order, and that everything's running smoothly.
Now, this brand new building built back in March, correct? What are the services here? Like, when are you open? Are you open 7 days a week? Are you open 5 days a week? And what are the office hours?
Currently, we're open 5 days a week, Monday through Friday, from 8 o'clock to about 4:30, 5 o'clock, depending on the day. We have gynecological services. We have breast surgery. We have all sorts of imaging, diagnostic imaging, breast imaging, including our Boston, Massachusetts General Hospital imaging, breast imaging specialists that come here to specifically read those images.
And we're going to have an interview with Dr. Julie Jones, who is fabulous. She's been on my show before, and also Dr. Elizabeth Rafferty, who is with Mass General Hospital too. So you not only have a beautiful facility here, you have extraordinary equipment, and everything is top of the line, but you have a wonderful staff, which is important. People and well-known doctors that are prominent that really do care about women. And isn't that important, do you think?
Absolutely. I think, the first face that you talk to on the phone when you walk in is the staff, and it's so important to have, great staff backing up these wonderful doctors. And, like you said, Julie Jones, she's fellowship trained from Boston. She's up here in the Merrimack Valley area giving that Boston quality care to our women of the area. So.
And it's Breast Cancer Awareness Month, but every month should be Breast Cancer Awareness Month. And early detection is very important. And what are your thoughts about having a mammogram?
Well, I'm actually not at the age yet to have one, but I've heard from women that come through our facility that we have state-of-the-art equipment. It's brand new off the line. Dr. Rafferty actually assisted with creating this equipment, and she's our director of breast imaging. It's really amazing. We actually are the only ones in the area to have what's soon to be the next step in breast imaging, which is the tomosynthesis mammography, which is 3D mammography, and that's going to be a fantastic draw to our center. And, like you said, breast cancer awareness is definitely an every month thing for us. We see it every day. We have tons of women that come through here that we're able to, diagnose quicker and get into a treatment much faster.
All right, here I am with the top diva doctor, Dr. Julie Jones, breast surgeon. How are you?
Good morning. I'm well. How are you?
Good, and thank you for having us here at this fantastic facility. And I know it's doing very well. It's beautiful, but we have top-notch doctors here like yourself. Let's talk a little bit about yourself, a little bit about your background.
I am a fellowship-trained breast surgeon. I did a breast surgery fellowship at the Massachusetts General Hospital, so I just do breast surgery. I don't practice general surgery, and I've been doing this for over 5 years, and I'm very excited to be part of opening the new Women's Center here at Saints. I am the director of the Breast Care Center at Saints. And that's about it.
And what is your role here now? You don't do the mammograms? What do you do? Do you see the mammograms? Do you do just the surgery? Let's talk a little bit about what you really do hands-on here.
So I do surgery. That's it. I offer the surgical services, and I see all kinds of breast problems, both benign, malignant. Benign problems are breast lumps that need to be evaluated, or nipple discharge, or really anything unusual. I also treat breast cancer as the surgeon, and as the surgeon, I am part of the team that treats breast cancer, which generally involves a medical oncologist and a radiation oncologist. But very often those patients see the surgeon first, so I sort of get to spearhead that effort a little bit.
And do you feel that this is Breast Cancer Awareness Month? How important is a mammogram?
Crucially important. I know there's a little bit of controversy at the moment, but the data really show that screening mammography significantly improves survival of the disease because it allows us to find the cancers early when we can really do a very good job treating them.
Right. And in regards to the controversy, just in case some people don't know, explain a little bit about the controversy.
There's some new recommendations suggesting that women in their 40s don't necessarily need mammograms every year, that they can decide with their doctor who should have a mammogram and who should not, and that then mammograms should be either every 1 or 2 years, starting at 50. I feel strongly that women in their 40s should have a mammogram. Probably every year. And so right now that is still our recommendation.
Right. Dr. Julie Jones has been on Dacey's Divas before. She is fabulous. Let's talk a little bit, though. There is a lot of women out there under 40 that have had breast cancer, correct?
Absolutely. And women under 40 should absolutely do an annual a monthly self-breast exam.
Right. That's very important.
And have an annual clinical breast exam by their physician, either their primary care doc or their gynecologist.
And that's important.
And that is very important, yes.
Okay. Now, I heard Dr. Rafferty, she's just got passed from FDA a little bit about the new machine. Do you want to talk a little bit about the great news?
So Dr. Rafferty is the PI on the tomosynthesis study, which is kind of the CT version of the mammogram. And that has just received FDA approval, and we're hoping to get that started here as well as at Mass General. The machines here are all Tomo ready, we call it. So as soon as things are set up, we can turn them on and start offering tomosynthesis to our patients.
So now today I'll come in, have a mammogram, and you can read my results right there, correct?
So screening mammograms are not generally read right that minute. They are read within generally 24 to generally 48 hours at the outside. A diagnostic mammogram, which is a mammogram done for specific problems, for instance, a lump that the patient or her doctor feels, that is read right then. And if any additional imaging needs to be done, it can be done right then. And often we can arrange it so I'm seeing the patient the same day, and I do have immediate access to those films. I can either walk over and look at them with the radiologist or pull them up on the computer and take a look at them. And we can often set up a plan, whether it's just reassurance and follow-up or scheduling a biopsy right then.
I would like to thank Sharon Galvin and all of these remarkable, wonderful divas out here at Saints making a difference. Please, if you know these incredible divas like the divas at Saints, you can reach me at divas.us or my new website at massachusettswomen.org, and let us know if you need divas like Saints women that are out there saving women's lives. Thank you for watching Dacey's Divas, and I will see you soon.